However, what happens to the largest organ of the body? Many of you may be surprised to realize that it is not the skin, and it is in fact our GLYCOCALYX. The GLYCOCALYX lines all blood vessels and has a surface area of 4,000 to 7,000 square meters and a volume of approximately 1,700 mils. It is metabolically active and produces nitric oxide. Nitric oxide is a potent vasodilator that is critical to control blood pressure as well as microcirculation at the capillary level. The GLYCOCALYX is the gateway layer in transportation of nutrients and chemicals across blood vessel walls. It is a complex lining of every blood vessel made up of a combination of carbohydrate and protein in the form of glycoproteins, polysaccharides, proteoglycans and glycosaminoglycans, thereby rendering the entire layer susceptible to changes in blood glucose. The GLYCOCALYX is probably one of the least understood areas of the body, yet critical to our homeostasis. Belinda and Cam's 2017 review of the endothelial GLYCOCALYX gives an excellent overview, including the damaging effect of diabetes. The GLYCOCALYX is fragile, and most modern lifestyle and environmental factors are likely to damage it, in particular carbohydrates and their metabolites. Some of these factors overlap, but have all been documented in the literature. The damaged GLYCOCALYX results in an increase in vessel permeability of all substances. When the GLYCOCALYX is damaged, it not only loses its ability to produce nitric oxide, but the damaged layer creates an increased permeability of blood vessel walls. This is a similar concept to what we understand as leaky gut in the intestine. The breakdown of tight junctions increases susceptibility to toxic material crossing from the gut into the bloodstream. The loss of GLYCOCALYX layer allows material to move out of the blood into the tissues in an uncontrolled fashion, thereby rendering every corner of the body susceptible. GLYCOCALYX recovery from an acute glucose load can take hours to recover. Some studies claim that the recovery time frame may be 5 to 7 days. Diabetics with chronic hyperglycemia have an average 50% reduction in GLYCOCALYX thickness and resulting increased permeability and thrombosis potential. The GLYCOCALYX damage is greater with poorer control of blood glucose, as evident in the type 1 diabetes population. The poorer circulatory flow and increased permeability place those with diabetes at much higher risk of cardiovascular compromise and organ failure. So, after considering the direct effects of an elevated blood glucose, there is the added indirect effect on the whole body as a result of elevated insulin secretion.